Now, I think it's important to know that there are several different types of incontinence. So that if I leak and you leak and you leak and you leak and we all leak, we don't all have the same problem. We don't all have the same cause of why we're leaking either. And that's why it's really important that if you begin to notice leakage, whether it's with urgency, whether it's with coughing, sneezing, laughing, changing position, whether it's when you're walking, whether it's when it's just unexpected, that you get some help, because we need to figure out what kind there is. So let's talk about the different types of incontinence. Most common among women is stress incontinence. And that's where you leak with cough, sneeze, laugh, jump, that type of thing, okay? Now, the cause of that type of incontinence is a weak pelvic floor, which is the area between your vagina and your rectum. That's your pelvic floor. That becomes weak. And for women, if you have a lot of babies, that can cause added weakness to that, especially if you've had an episiotomy, or worse yet, if you just tore with a vaginal birth. Now, the bad news is for those who have never had a vaginal birth is that they're finding that those women are still having stress incontinence, whether you had a C-section or whether you never got pregnant at all. So that nobody is exempt from the possibility of becoming incontinent. So one of the other causes of stress incontinence is being overweight. If you have too much weight on your stomach here, you can just well imagine that as your bladder becomes enlarged and full of urine, that your urethra that is coming out of the bladder has to hold that in. There's another muscle on the side of the bladder that we call a sphincter. We actually have two of them. One at the neck of the bladder where the urethra fits right in. There's one right there. And then there's one right on the sides of the urethra. So when you cough, if you take a big deep breath and you cough, what happens is this sphincter closes tight, this sphincter squeezes the urethra tight. And that's all supposed to happen. And this sphincter that squeezes the urethra tight is done so by the help of the pelvic floor, which is made up of lots of different muscles. Okay, and it just squeezes that. And that's how everything works. Now when those things are not working, you're gonna leak. And then when you have other problems that are accompanying those problems, you're going to leak more. For instance, if you're pregnant, if you're overweight, those kinds of things. Now, the second kind of incontinence is what we call urge incontinence. And this is very, very common as well. About 33 million people in this country have urge incontinence. That's a lot of people. It's about 20% of our whole population or more. And so what happens with urgency is, urgency comes in different categories. And I always like to ask my patients, so tell me, when you get the urge to go, what happens? Do you feel that urge and you just go right away? Do you get the urge to go and when you get up to go to the bathroom, you leak? Do you get that urge and you're on your way to the bathroom and you leak in about 1 or 2 minutes? Or do you get that urge like some of you might have right now and you can wait until I'm finished talking and go to the bathroom? So there's different kinds of urgencies. There's different severity of urgency. And it's important to know that each one of those might be treated a little bit differently. Okay? The third type of incontinence is what we call mixed incontinence. It's the unfortunate fact that you have a little of everything. You've got stress incontinence, you've got urge incontinence, or you've got stress incontinence and you have urgency. So that's the third kind. The fourth kind is what we call overflow incontinence. And that's where the bladder becomes so full and the muscle is so weak for whatever reason that you never really empty your bladder completely. And one of the key characteristics of that is people will say to me, you know what, I just leak all the time. I could be walking from here to there and I'm leaking. I don't have the urge. I'm just going. That can be one symptom of overflow incontinence. You're just not emptying your bladder. And the problem that that can have is that if you don't empty your bladder, you can also be prone to urinary tract infections, which can be a worse problem, especially as we get older. Our immune systems aren't that great, and we just want to make sure that, you know, we're not harboring bacteria in our bladders or anywhere else in our body. So it's important to make sure that, you know, we are emptying. And what we do for that is, number one, we look at what kind of medications you're on, because some medications can cause the bladder muscle to be weak because they want to relax other muscles in your body. The other thing we look at is, you know, are you emptying your bladder properly? Do we need to teach you some bladder emptying techniques? And so that's another way that we treat what we call overflow incontinence. Then the fifth kind of incontinence is what we call functional incontinence. And this is a type of incontinence that sometimes easy to fix, sometimes not so easy. And it's just a matter of function. If I gave all of you 5 glasses of something to drink, and I said, now you're going to sit here for 3 hours, and you can't go anywhere. By the end of 3 hours, all of us would be wetting our pants. So that's called functional incontinence. Some of the causes of that are dementia. People can't remember or don't notice where a bathroom is. Another cause of that is mobility problems. Okay, you ladies in your walkers, if you had to go to the bathroom and all of a sudden there's a door jam and you can't get out and you have to wait an extra 10 minutes, 15 minutes, you might not make it. So that's another cause of functional incontinence. Another cause of it is depression. And it might seem kind of silly, like, how does depression cause incontinence? When people are truly depressed, they could care less if they went to the bathroom. And so they might just lay there, sit there, they don't really care, they wear Depends, so I have it, it doesn't matter, I don't want to go to the bathroom, you know, that type of thing. People might have pain, and if they're not being adequately treated for pain, it hurts to go to the bathroom. Have you ever had pain in your hips or your knees or anywhere and you had to go sit on one of those really short toilets and then you had to try to get up from that? Well, people aren't going to want to do that very often if they're having a lot of pain. So it's important that if you do have pain that you let your provider know. So functional incontinence is an important thing that we really look deep into, see how we can take care of that. Sometimes it's just a matter of a caregiver being around and somebody just reminding people to go to the bathroom, because people forget that they haven't been to the bathroom for a long time, then all of a sudden the bladder gets full, then there's urgency, and then they just leave. And that's a normal kind of thing. That's not a problem that can be fixed with medications. Sometimes people think, well, if I get a medicine, then I don't ever have to go to the bathroom, and isn't that nice? But that's not true. Because if you get treated with medication, you have to really go to the bathroom.